I'm a local emergency department physician. I'm a local emergency department physician here. I work at Penrose St. Francis, the Centura facilities. I also spent years working at Memorial Hospital here before I went to Centura. And I do all the medical direction for Colorado Springs Fire Department and El Paso County AMR, and so pretty much tied into the pulse of what happens out there in the medically in the pre-hospital setting. So I'd like to reiterate a couple of things that Karen was just mentioning. There's in the emergency department, we're kind of standing up here telling you what we see day to day in the emergency department. If you had asked me 4 or 5 years ago, before all the legalization for recreational use was coming down the pipeline, what I think I would be seeing, 5 years from then in the emergency department is not what I'm seeing today. We've really been quite surprised, just anecdotally, on what we are seeing and how we are seeing it in the emergency rooms. We do get a tremendous amount of people who have just shown up. They've just come and entered the boundaries of Colorado. They usually work their way south, which is interesting. They often will start in Denver. And again, this is just anecdotal stories that they'll tell us, but there's a very, very consistent theme. I very rarely, actually I've met one, but I've only met one person that was in Colorado Springs working their way up north back to Denver. Most of them tend to come to Denver and are homeless and are very young homeless and jobless, and they show up in Denver. They find it more difficult to operate in Denver. They're told that south is better, and they need to come to Colorado Springs because they'll take care of the homeless people. And if they really want the epicenter of where they're going to be treated the best, they can go to Manitou Springs. And then eventually there's the people who say, it's no longer working for me here, I'm going to go to Pueblo. Okay, and so Karen alluded to how bad it is getting in Pueblo. I think the emergency departments are fantastic microcosms of the representation of what's happening in the society with marijuana, recreation, legalization. And don't get me wrong, we ask them, sort of jokingly, but I'm always interested in the answer. When patients come in and they smoke marijuana, I say, which shop do you buy your marijuana at? Okay? And of course, none of them buy it at any of the stores, right? They didn't come here because they could walk into a store and buy marijuana. They came here because they know they could get the marijuana illegally and then smoke it and have it and just be present with it without getting in trouble with law enforcement. And so, we're not, these are not the people that we're getting all the tax revenues from. And so I would venture to say that that's probably the far majority of marijuana users. So these are just some stats, and this is specifically for Colorado since 2013 and the legalization process. That New England, and then one of them was published in the New England Journal of Medicine, and this was just one this year in February, saying that that the emergency department visits, and they were referencing Colorado specifically, of visits that are possibly related to marijuana among out-of-state residents have doubled in the year between 2013 and 2014. And so that's pretty significant. That's obviously a 100% increase. And there's a couple of telling things in there. I put quotes around this. Well, actually, I got one quote. I didn't close the quotes. So the visits that are possibly related. Again, it's difficult to attribute something directly. It was mentioned before, I drank a cup of coffee, therefore the sun came up. Okay, can we say that every single person that comes into the emergency department that admits to or we find has been using marijuana that we can absolutely attribute what's going on with them to marijuana. Sometimes it's easy, sometimes it's not, and so that's why they say possibly related. They qualify that. Okay, but there definitely is, even if you possibly relate it, when it's double the amount of patients in 1 year, something, is obviously going on there with this correlation. The Rocky Mountain High Intensity Drug Traffic Area Organization, which is obviously local by the name in our state, published in 2015 that the marijuana-related emergency room visits are up 68% from 2011 to 2014. There was a much larger spike during the first 2 years of 11 and 12, and then it went up but a little bit more slowly, 13 and 14. This is something that I never thought I would talk about or get into, especially because I'm not a travel agent. But we recognize this in the emergency departments. Now, we in Colorado Springs and in the Denver area and in the mountainous areas, emergency departments see this probably more than Pueblo. Okay, it was mentioned that in Pueblo, they're dealing with a tremendous amount of the homeless populations. We deal in Colorado Springs with some of the more affluent marijuana users, and interestingly, they are typically not they're not local. Okay, and there's a huge tourism component to our state right now that we do, and this was a poll, and I'm sorry I forgot to mention who this was, but this was one of the monitoring organizations that's looking at the effects of marijuana in our state specifically. In a 2015 poll mentioned that literally about half of the people across all age ranges, okay, when they're obviously making that decision for themselves, that are coming to Colorado have some degree of saying, I want to come here because I can experience this. In a way, it's sort of like the United States' version of the Netherlands, where people say, I'm going to go to Amsterdam, I'm going to stop off in Amsterdam because I can go into one of the pop bars or something like that. It's not necessarily means they're going to center their visit around, but it is very telling that literally half the people were saying, I'm going to go do this because I want to use the marijuana. This is another very, very specific agency, Colorado 420 Concierge Service. And this is just another example that they will actually provide arrival to departure services. So they'll come pick you up in these really fancy limousines or vehicles. You can smoke or eat or do whatever you want with the marijuana. They always drive people directly, even before they drop people off at their hotels. They'll drive them directly to the marijuana stores. At which time most people don't really want a joint to smoke marijuana, because if they're familiar with marijuana, that's typically what they've done in the past. And so they want the new experience, and so they usually go for the edibles. And that's usually what lands them in the emergency department. So what happens to people, and I'm not necessarily talking about the homeless, I'm talking about all comers, what happens to land them in the emergency department? It's not always that they've overdosed on the medication, on the marijuana. A lot of times it is, because as has been mentioned multiple times already this morning, people do not know, they don't have a history of understanding or a concept of understanding how to consume the edibles. It's very, very difficult to understand that a cookie is 10 doses or 20 doses. Okay, and so what happens is typically people will consume marijuana in one way, shape, or form, and then just like alcohol or any other substance that's mind-altering, they end up physically or mentally in trouble, And that either has them calling 911 or coming to the emergency department from a physical injury, usually, a lot of times some mental breakdowns, but usually physical injuries as a result of using the marijuana. EMS calls, I talk about that just because, as I said, I do the medical direction. We do not, maybe I shouldn't say this, but we didn't specifically collect exactly what overdose data was before the marijuana legalization at the fire department or AMR. We would have a catch-all category that says that we ran on this many patients this year in this area that were overdoses. And it wasn't until recently, over the last couple of years, that we've actually started to separate out. This was an opiate overdose, this was a marijuana overdose, this was a cocaine overdose. And so, because these organizations, the EMS agencies, are not really scientific organizations, right? They're not doing this to study things. They just categorize what they're going on. Is it a trauma? Is it a chest pain? And so we started to separate out, since the legalization, how many runs we were making that were marijuana associated. That was the primary attribute that either the call takers were telling us, or that the patients, upon arrival, were telling us was the issue. And that has increased over 150% since the legalization. Part of it is that people don't have a problem telling us they're using it, whereas before they may not have said that, and we just had to guess by all the bombs sitting around. Because as savvy as people think they are, taking medicine into the field is totally different, because we entered their environment. Okay, and when people usually have some sort of marijuana or drug associated issue, when they try to clean up for 911 to come, usually their cleaning service isn't all that great, and stuff is all over the place, and we can tell what's going on. Interestingly, we talk about all of this amazing influx of people who end up in the emergency room. Statistically, in our community right here in Colorado Springs and El Paso County, over 90% of the 911 calls that go out for marijuana-related issues are not ultimately transported to the emergency department. It's more of a calming, saying, we're really sorry you've made poor decisions. We don't use those words, but we're really sorry you made this happen to you. Is there somebody here that can watch you? There's nothing that we can really do for you. Obviously, if somebody is not clinically stable, which can happen, we do transport those people. But a lot of them are just left on the scene. So let's talk a little bit about the adult overdoses. I know we keep pounding this in, but it's very, very true. The adult overdoses are coming from the edibles. Okay, they eat all of these. They don't understand the dosing. I had one specific lady that came in right after the legalization. She was all excited, had gone to one of the new Manitou Springs, or actually the Manitou Springs store at that time, and bought a package of Oreos, and went home and just took one whole Oreo, which was 10 doses. And so she thankfully did not say, oh, this didn't work, I'm going to, after 20 minutes and take more, which is a typical story. But when this hit her, she was completely incapacitated. And so family actually drove her in. They were visitors, and they drove her in, and we had to watch her for 12, 14 hours or so in one of the beds until she was stable enough to get up and walk out. And so we always caution people. We try to just be public servants, okay? Just spread the word. Tell everybody else that got off the plane with you and is on your tour limousine, okay? If you are going to eat these edibles, eat them, look at what the dosing is, eat them very cautiously, and please don't mix them with anything else that can be mind altering. I mentioned alcohol here. Somebody asked earlier about exactly the relationship between co-dosing alcohol and marijuana. I don't specifically have that knowledge of alcohol versus opiates versus cocaine or whatever else you want to be using with marijuana, but it's generally known not to be a good idea to mix it with any other psycho-altering substances. So here's one interesting case that actually happened to me. I'm telling you all the cases that I've seen. This was a 50-year-old female who was local, and she actually was kind of eats some marijuana, uses some sprays, does stuff. She doesn't really use it that often. She doesn't use it to what we would say is an extreme amount, and she has private insurance. She had a mechanical fall over her grandchild's toy and ended up with a really, really bad fractured dislocation of her right ankle. You cannot weight bear on these. You can't even get up. And so everybody who gets this pretty much has to be transported to the emergency department because you just can't make it on your own. So she called 911. She came in. She was also on blood thinners because she had a blood clot in the past. Okay, and the reason why I mention that is because when somebody falls and they're on blood thinners across the country, when you are those two things together automatically make you a trauma patient. Okay, because the likelihood of you having some sort of injury that can make you bleed inside because you're on medication that won't stop the bleeding. And so when you do that, you're automatically categorized as a trauma patient and you automatically get a urine tox screen. Okay, it's pretty just standard across the country. And so where if she had just been not been on blood thinners, we probably wouldn't have gotten this urine tox screen because it's not going to make a difference on how we treat somebody. And but because of her circumstance, we did, and it showed positive for marijuana. And she went through her surgeries and did everything, and then she got a bill for $56,000 and change with a letter from the insurance company that says we're not going to cover one penny of this. Okay, because you tested positive for marijuana and we have an exclusion clause that says any alcohol-related or drug-related, recreational drug-related incidents allows us to say we're not going to pay for it at all. So she came back to me, as well as many other people, and wanted us to write letters to the insurance companies saying that the marijuana had nothing to do with why she tripped over this toy, and that if she had been using her little spray or not, that she would have tripped over this toy. Of course, I can't say anything to that effect. All I can say is you tripped, and this is what we found. And so this is, I imagine, going to be something that we're hearing about more and more. One thing that a lot of people don't talk about is the elderly, especially now with the recreational use and increasing around the country with the medical use of marijuana. There's a markedly increasing elderly population that is using marijuana. There's almost this movement in certain circles to say, we can take somebody off of all 72 medications that this person is on, and marijuana is going to solve it all. Okay? Because they become so calm and cool, and they don't get out of bed as much, and we can keep them in the memory care unit, at the assisted living facility or the nursing home, and it's the best thing since sliced bread. We actually, although this was surprising at first, it's no longer surprising. I just dealt with a 96-year-old person the other day who came into the emergency department who basically was there for a marijuana overdose. And she was, once she woke up, she was as happy as could be and wanted to know why she was there, and said that her doctor had basically taken her off of most of her medications, and that she uses the marijuana, but not that much. And I said, well, what's not that much? She says, well, about 5 times a day. Okay, and so we've learned that no matter what age somebody is, you ask them, do you use marijuana? And they say yes. And we say, how often? And their answer is typically not much. And then you say, well, what is not much to you? And usually not much means multiple times a day. And so at that point I say, well, what would be a lot to you? Nobody really has an answer to that. But I've learned that when they say, I don't use it very much, we have to actually specifically ask what that means. All right, so so just to reiterate, we usually don't think of the elderly, or when we do think of the elderly, we think of it as like the story that Karen just told, where somebody innocently went and got a block of butter and put it on their toast. But there are a lot of elderly patients out there that are using this and replacing it with all replacing all their medications with it. So the pediatric overdoses. This is a study from the American Medical Association journal that was talking actually about Children's Colorado Hospital, where they were talking about the increase in exposures and increase in poisonings that have gone up tremendously, specifically since the legalization of recreational use. They are not actually saying in this article that everybody is that they can draw direct correlations, but what they are saying is, since the legalization, it obviously increases exposure, and that has shown an increased amount of people who are ending up in the pediatric patients that are ending up in the emergency room. This was a 4 and 5-year-old siblings that we had that found some gummies that their mom was actually did some hotel work, and she took what she thought was extra candy from the hotel, and they had it in the bags, and these kids got into them, and of course what they did was they just took a bunch of gummies and just put them in their mouths. That's what everybody, I don't know one 4-year-old in the world that eats gummies one at a time. Okay, my kid has a personal challenge every time is, can he fit the entire package in his mouth at once? And so, and you can see that could be just absolutely devastating. And of course the parents are devastated too. I don't know any parents that are happy about this. But they do come in and they end up being monitored sometimes for a couple of days in the hospital. Charlotte's Web, it's been mentioned multiple times. It's interesting because northern Colorado Springs area has an enclave of people that have moved there from all over the country for their kids to be able to use the marijuana derivatives for their children and the seizures. Interestingly, we do not see them in the emergency department, but we do encounter them in the field a lot, and usually it's because somebody else got into a medication or there's another issue. But it is interesting to know that Colorado Springs specifically, and specifically northern Colorado Springs, has probably one of the highest concentrations of these kids that use Charlotte's Web. So I know I only have a couple more minutes here, so I'm going to go through a couple of the things that we see daily in the emergency department. We have the marijuana use disorder is what we call it, where people are, we're not saying they're addicted, we're just saying that their patterns of life and their usage patterns have really, really altered the way that they use marijuana and have become a dominating feature. This is commonly untreated. People just blow it off. They say, fine, you smoke marijuana, you use marijuana, and they don't really think of it much. But the studies are really showing that this is consistent with polysubstance abuse and increased mental health disorder. We've talked about already this morning the hyperemesis syndrome. Somebody mentioned a really good point earlier about, I thought you were saying that the marijuana subdues nausea. Okay, and this is a paradox, and we don't have all the answers to this yet. But there is very, very specifically a correlation between chronic high-dose marijuana use and hyperemesis, which in layman's terms means vomiting all the time. It is not cyclic vomiting syndrome. Okay, it is something that is specifically induced with this. It will stop eventually if you stop the marijuana. It's very, very difficult to explain this to people who've been using yours, that all of a sudden this may be causing that for them. Usually they don't believe it until the 5th, 6th, 7th time they're in the emergency department, and then maybe they'll try to entertain it. I'm going to skip respiratory issues because we've talked about that. The psychiatric concerns definitely is a huge, huge deal. It's kind of the big elephant in the room that everybody wants to ignore because I don't think people can even wrap their minds around how to deal with it. But marijuana use is known to exacerbate and sometimes bring on and predispose people for psychosis and make things worse. And so we do end up with a tremendous amount more of psychiatric issues, and our state is not really the best equipped to deal with that. So who pays for all of this? Okay, the marijuana lobby would like you to understand that the taxes, the tax revenue that is being collected is going to pay for every potential bad consequence of marijuana and is just going to sail us into the sunset. But if you took the medical and psychiatric consequences that could be attributed to increased marijuana use, just took that, the taxes wouldn't even begin to scrape the surface. And so that's a lot of politics. So in the end, what do we have here? We have a very, very mixed picture. We have people who are really trying to promote this for political and financial gain. And there's a lot of great stories out there. And then we have the reality underneath of what we're left with and what our state is going to have to do to clean this up. And of course, that we're definitely behind on that, because I think this is so accurate. Okay, and we're sitting there saying, now